Anemia is a medical condition in which a person has a lower than normal number of red blood cells or a lower than normal amount of hemoglobin in their blood. Hemoglobin is the protein in red blood cells that carries oxygen to the body's tissues. There are many different types of anemia, but the most common is iron deficiency anemia. This occurs when the body doesn't have enough iron to produce adequate amounts of hemoglobin. Other types of anemia can be caused by problems with the bone marrow, which is where red blood cells are produced, or by certain medical conditions such as kidney disease or autoimmune disorders. Symptoms of anemia can include fatigue, weakness, shortness of breath, pale skin, dizziness, headache, and irregular heartbeats. Anemia can be diagnosed through a blood test, and treatment depends on the underlying cause. It may include iron supplements, vitamin supplements, blood transfusions, or medications. Here are 5 common causes of anemia. Iron deficiency. This is the most common cause of anemia, especially in women of childbearing age, and occurs when the body doesn't have enough iron to make hemoglobin. Vitamin deficiency. Vitamin B12 and folate are both necessary for the production of healthy red blood cells. Deficiencies in either of these vitamins can lead to anemia. Chronic disease. Chronic diseases like kidney disease, cancer, HIV, AIDS, and autoimmune disorders can affect the production of red blood cells and lead to anemia. Blood loss. Any kind of bleeding, whether from an injury, surgery, menstruation, or gastrointestinal issues, can cause anemia if it is severe or prolonged. Hereditary conditions. Certain genetic conditions like sickle cell anemia and thalassemia can cause abnormal hemoglobin production or breakdown, leading to anemia. Here are 21 foods that are high in iron and can help treat anemia naturally. Red meat. Beef, lamb, and venison are all excellent sources of iron. Organ meats. Liver, kidneys, and other organ meats are especially high in iron. Poultry. Chicken and turkey are good sources of iron, especially in the dark meat. Seafood. Clams, oysters, sardines, and tuna are all high in iron. Beans and legumes. Lentils, chickpeas, kidney beans, black beans, and soybeans are all good sources of iron. Tofu. This vegetarian protein source is also high in iron. Dark leafy greens. Spinach, kale, collard greens, and Swiss chard are all good sources of iron. Nuts and seeds. Pumpkin seeds, sesame seeds, cashews, and almonds are all high in iron. Whole grains. Quinoa, brown rice, and oatmeal are all good sources of iron. Dried fruit. Raisins, apricots, and prunes are all high in iron. Iron-fortified cereals. Many breakfast cereals are fortified with iron. Molasses. Blackstrap molasses is a good source of iron. Brewer's yeast. This nutritional supplement is also high in iron. Dark chocolate. A small amount of dark chocolate can provide a significant amount of iron. Beef jerky. A snack made from dried beef can be a good source of iron. Eggs. The yolks of eggs contain iron. Coconut milk. This dairy-free milk alternative is also high in iron. Vegetables. Broccoli, asparagus, and Brussels sprouts are all good sources of iron. Herbs and spices. Thyme, cumin, and turmeric are all high in iron. Blackstrap molasses. This sweetener is high in iron and can be used as a substitute for sugar in baking and cooking. Prune juice. Drinking prune juice can help increase iron levels. If you're interested in improving your nutrition and overall health, consulting with a registered dietitian or other qualified nutrition professional can be a good place to start. They can provide personalized advice and support, help you create a healthy eating plan that meets your individual needs, and provide guidance on managing any health conditions or concerns you may have. It's important to remember that nutrition advice should always be based on sound science and evidence-based research. While there is a lot of information available online and through social media, not all of it is accurate or reliable. By working with a qualified nutrition professional, you can be confident that the advice you receive is trustworthy and tailored to your specific needs and goals.